How much is Social Security going up and how much is Medicare Part B going up? These are both things that we are not quite sure of yet. The actual numbers won't come out until later this year, but I'm your Medicare guy, Ken, and we are keeping the pulse on this so you can hopefully get ahead of whatever's about to happen in 2025. So once again, this is Medicare News presented by NJ Life and Health. The article is Social Security's 2025 COLA estimate inches up, but Medicare Part B premium may wipe it out. The latest estimate of Social Security's cost of living adjustment, or COLA, for 2025 rose to 3.2% after the government reported that April inflation was in line with economists' forecasts, new calculations showed Wednesday. The 2025 COLA estimate has risen all year as inflation remains elevated and above the Federal Reserve's 2% target. It stood at 1.75% in January, 2.4% in February, and 3% in March. So what they're saying is they believe that inflation is getting tamed. We might not necessarily feel it at the moment because prices are so much higher from years ago, but they're basically saying we're going to give less of an adjustment potentially because we're starting to see inflation be tamed. Overall prices increased 3.4% from a year earlier, down from 3.5% in March. Overall prices increased 3.4% from a year earlier, down from 3.5% in March, according to the Labor Department's Consumer Price Index, a gauge of goods and services costs throughout the economy. On a monthly basis, costs rose 0.3%, below the 0.4% rise the previous month. So again, you might not be necessarily feeling this, but we are starting to see inflation taper off, and the government is going to try to start planning accordingly. So COLA is based on the Consumer Price Index for urban wage earners and clerical workers, or CPIW. That figure dipped to 3.4% from March's 3.5%, but still outpaced the 3.2% COLA Social Security recipients began receiving in January. So they gave a 3.2% increase, and everything is up 3.5%. So it's lagging behind a little bit. CPIW excludes the spending patterns of retired and disabled adults, most of whom receive Medicare benefits. The higher inflation indicates that consumers are still experiencing an erosion in buying power, said Mary Johnson, a retired Social Security and Medicare policy analyst for the nonprofit Senior Citizens League, who still tracks the data. So what we're seeing is more inflation, even if it's tapering down, but the buying power of seniors, older adults, is still low. Okay, items on which seniors spend the most money increased significantly over the past year. Hospital services rose 7.7%, transportation services soared 11.2%, shelter jumped 5.5%, and electricity climbed 5.1%, said the government. It can be tough because, inflation can't always be calculated perfectly. Consumer price indexes can't always be calculated perfectly, and we see that in a lot of cases maybe inflation is tapering down, but we're still feeling the negative effects of so many years of consecutive inflation. Medicare wildcard. Expected Medicare Part B premiums for 2025 are likely to eat up most, if not all, of COLA's rise, Johnson said. Medicare's trustees estimate that the standard Part B premium for 2025 will increase at nearly double the rate of COLA. The Medicare trustee report released last week, the trustees estimated Part B premiums would climb by $10.30 a month in 2025 to $185. That's an increase of 5.9% from $174.70 in 2024. This is big. Obviously, the increase is sometimes it's $4, sometimes it's $20, $30, $10. Seems about in line with what we would see year over year. It's obviously not great. We saw this a couple years ago. There was a big COLA increase, but the Medicare Part B premium also jumped up about $20, $30 a month as well. So a lot of people were like, well, I got this COLA increase, but my Part B premium ate up most of it. So I think that's what they're alluding to here, is that the COLA increase is minimal. The Part B increase is quite big, relatively speaking, and they could cancel each other out. Nevertheless, Part B premiums are one of the fastest growing costs in retirement, and those premiums are deducted directly from Social Security benefits, Johnson said. So a lot of people might be shocked by this. Obviously, the COLA impacts different people differently. If your Social Security benefit is $3,000 a month, then 3% of $3,000 is $90, so you won't feel that $10 increase quite as much, but if your Social Security benefit is $1,000, your COLA, it's only going up $30, and that $10 could really hurt you. So this is going to affect different people differently. How is COLA calculated? The Social Security Administration based its COLA each year on average annual increases in CPIW from July through September. The index for urban wage earners largely reflects the broad index the Labor Department releases each month, although it differs slightly. So this is interesting. A lot of people have argued if CPIW here is the best way to go about it. You know, we're not really sure if it's the best or not, but it's what we use. And a lot of people complain it doesn't often really take into account all the costs that are going up with inflation and that it kind of lags behind. What was 2024's COLA? Older adults received a 3.2% bump in their Social Security checks at the beginning of the year to help recipients keep pace with inflation. That increased the average retiree benefit by $59 a month. Seniors fall more behind. COLA is meant to help Social Security recipients avoid a lower standard of living, but it hasn't worked in reality. Poverty has increased among Americans 65 and older to 14.1% in 2022 from 10.7% in 2021. That increase was the largest jump among any age group, according to the latest U.S. Census Bureau data. The thing we always see is that older adults, people over 65, about 50% of them are living on under $30,000 a year, which is really not that much if you factor in how expensive housing is, how expensive medical care is. It can really hurt people's bottom lines and make people have really tough decisions in terms of like how they're going to live their life. It's very sad to see. And with Social Security's reserves projected to run out in 2035, things may get worse. Congress is painting itself into a corner on fixing Social Security's pending insolvency, Johnson said. Failure to act on the program in time would lead to automatic benefit cuts. Without changes to reduce costs and or raise revenues received by the program, the Social Security trustees eliminate that all benefits would be reduced by more than 20% to match the amount of tax revenues received by the program after 2035. So this is tough, guys. I mean, what do you guys think? Like, Social Security does not seem to be keeping pace with inflation. It does not seem to be adjusting for Medicare Part B, which is more our specialty. You know, we are Medicare experts. We're not Social Security experts by any stretch of the imagination, but it's always interesting to see how these COLA adjustments affect Medicare Part B and people's ability to budget for healthcare. So let us know what you think about this in the comments. Let us know if there's any other stories you want us to cover. And as always, I'm your Medicare guy, Ken from NJ Life and Health. I will see you in the next video.